The episode starts where Dr. House gets a case of a nun whose name is Augustine with the skin ailments. On asking what does she do, she replies she helps out in kitchen, and on being asked if there is anything new in the kitchen, she replies that they got a donation of saucepans and pots this week and she unpacked them and washed. Dr. House, on examining, diagnose it as contact dermatitis, and she is allergic to dish soap. But this nun, who seems not satisfied with the diagnosis as many of the patients, says,
"Nonsense. We have always used that soap. Why is there a problem now?"
Dr. House explains her that a person can become allergic to substances that they have had repeated and prolonged exposure to. He gives her an antihistamine to stop the allergic reaction and advises her to take it 8 hourly and cautions her that she may feel sleepy. The nun takes the pill with tea. Everything was fine till then. Dr. House goes out, and then suddenly one of the nun comes and tells something is wrong with Sister Augustine. They rush in, and we see Sister getting an asthma attack. Dr. House grabs a preloaded syringe of epinephrine, which acts quickly, helps to open up her lungs and breathe. All are shocked to know that it was an allergic reaction and she is allergic to anti-allergic medicine. Then all of a sudden she goes into a cardiac arrest. Now the administrator and the dean of the medicine, Dr. Lisa Cuddy, accuses Dr. House that there are both 0.1 cc and 1 cc of epinephrine, and you might have reached for the wrong one and given her 1 cc of epinephrine, which can cause a cardiac arrest, and that he did not even make notation in the chart so that we can check. But Dr. House strongly says that he gave 0.1 cc of epinephrine, which was the standard dose for the respiratory distress, and Sister Augustine might have got some pre-existing heart condition which got exacerbated by epinephrine. But still, Dr. Lisa says if he does not prove that Sister Augustine had a pre-existing heart condition, then it is clear that he messed up and she will report his negligence to the committee. Now Dr. House goes for finding if there is any underlying cause. First one was the skin infection cellulitis, but it does not fit because there was no history of fever, and the complete blood picture did not show any signs of infection. Second, eosinophils are slightly elevated. ESR was high a little bit, may a systemic allergic response. It was also ruled out because the allergies cannot cause cardiac arrest. The third guess was vasculitis, inflammation of blood vessels, but it does not cause the elevated eosinophilic count, so ruled out. They come to the diagnosis that it may be Churg-Strauss syndrome because all of the symptoms match and elevated ESR is seen in it. And so they decide to take a CT scan of chest to know whether she is presenting with the pathology of Churg-Strauss syndrome, and start their treatment, prednisone, which is a corticosteroid, 40 mg TID. When our handsome Dr. Chase takes her to the CT scan room, Sister Augustine reveals a little bit of her backstory, that her parents died when she was 6, and she was raised in a foster home run by a church. When she was 18, she went to monastery where she took her vows. They prepare her for CT scan. In the scan they found that there is no vascular pathology, which means no Churg-Strauss syndrome. Then suddenly Sister complains of weird smell. They get her out, and after coming out she develops visual hallucinations as if she is seeing Jesus. Finally she goes in seizing. Now the patient, that is Sister Augustine, is tested positive for herpetic encephalitis, and the symptoms of weird smell and hallucinations are of herpetic encephalitis. This happened because her immune system was severely compromised, and that happened because of some another cause. They trace the symptoms and come to conclusion that it may be mixed connective tissue disease because it fits the symptoms. But the ANA, the anti-nuclear antibodies, are normal, so Dr. House orders to withdraw the blood. But they cannot start the treatment because The treatment for the mixed connective tissue disease is corticosteroids. And they cannot give them now because the immune system is compromised, so instead Dr. House suggests to modulate her immune system by putting her in hyperbaric oxygen chamber, which is, by the way, not the correct protocol. When Dr. Lisa finds out about all these, she throws Dr. House out of the case. Now Dr. Lisa takes up the case and decides to treat the symptoms because she thinks that sister is not having any underlying cause. Now being off the case, Dr. House goes to the monastery where Sister Augustine lives to find out more about her. After digging out, he gets some interesting information about her. Sister Augustine left the foster house when she was 12. She lived on the streets and she got into drugs. When she was 15, she became pregnant, tried to self-abort. She lost the child and she became ill. She came back and became a nun. But Dr. House cannot find the history anything relevant to the case. As he sips the tea offered by the sister, he finds out that the tea is made of some local herbs and it is called figwort. It is a figwort tea which opens the lungs and increases the blood pressure, stimulates the heart, and unfortunately, if given even 0.1 cc of epinephrine at the condition, it can cause a cardiac arrest. Do you remember when the sister came for the first time? She took the antihistamine tablet with tea. So that is the one which made the things worse. So the case is solved halfway. The cardiac arrest is out of the equation, and rest of the symptoms can be explained by a severe long-term allergic reaction. As the symptoms persisted many days, even after dishwashing, they ruled out the dish soap allergy. They decided to skin test for allergens, but as she was very sensitive, they decided to put her in a clean room, which has filtered air, filtered water, and everything is hypoallergic. But guys, still, she goes in an anaphylactic shock, where they had to intubate her. She had an allergic reaction even in a clean room. That means there is something inside her, to which she is allergic to. So Dr. House orders a full body scan, and to everybody's surprise they found a copper cross IUD found stuck in her uterus. Now that is the conclusion: she is allergic to copper. She had a teenage abortion. IUD must have been left and embedded in the endometrial tissue, where it could not be detected. She had prolonged exposure to the allergen, the copper, with the minimal symptoms, but at some points all it takes is one last contact to cause a full-blown reaction. Just like a balloon filled with air, one last blow it explodes. Sister Augustine recalls that she first got the rash when she was washing the copper cookware. One they scheduled the surgery for removal of IUD, and that is it. The sister goes home happily as she becomes healthy in few days. So that is a happy ending story where a nun was saved. Hey, it is not over yet. Let us look into some points which we learned from this video. Always enter the notation in the patient chart, what medicine you are giving, what dose you are giving, etc., so that it might not be a problem in the future. And secondly, it is very important to take a detail past history. If you guys like this type of videos, please let me know in the comments section. Like, subscribe, and support. Thank you.